So what is the best treatment for a rotator cuff injury? There are instances where surgery is the only option. If you come to see us in our office, we are going to do a comprehensive history and physical examination, and if after that evaluation we determine that surgery is the only option for you, we will let you know that. However, in most cases, surgery is not necessary, and there are other options that are better options for you that won't require surgery, and that is where we can be of most benefit. Hi, I'm Dr. Adelsheimer with Regenexx Pittsburgh, Southwestern Pennsylvania's premier provider of interventional orthopedics and orthobiologic procedures. So the two options that we have at Regenexx Pittsburgh are either Regenexx SCP or Regenexx SD. SCP stands for SuperConcentrated Platelets, also known as PRP. We use superconcentrated platelets in treating rotator cuff injuries when the injuries are more minor. So when somebody has chronic tendinitis or a smaller partial thickness tear, platelet treatment works great, and that is what we would recommend. In patients that have a more complicated or full thickness tear, that's where we get into the Regenexx SD procedure, SD meaning bone marrow concentrate containing growth factors and stem cells. The reason we use the more advanced SD procedure for the bigger problems is it works better to solve those problems. Bone marrow concentrate, which contains growth factors and mesenchymal stem cells, these cells have the ability to help the rotator cuff that is even a full thickness tear repair itself, so surgery is not necessary. These are the advanced healing cells that we have in our body that have the ability to create a significant healing response in these damaged areas. The other time that we will use the bone marrow concentrate or SD procedure is in the setting of a rotator cuff injury with arthritis, which is also very common, especially in the elderly. Because in those instances, we not only want to treat the rotator cuff, but we also want to treat the arthritis. Because if you only treat the rotator cuff without addressing the underlying arthritis, the outcome won't be as great. The reason we use orthobiologics, whether we're talking about the SCP platelet procedures or the SD bone marrow concentrate procedures, is we are flipping the odds in your body's favor. So yes, your body is trying to heal this problem already with the platelets and the growth factors and stem cells that you have. However, you do not have enough in the actual area where the problem is. So if we can gather those from another part of your body, be it from your blood where the platelets are contained, or from your bone marrow where the stem cells are contained, and we can take about 1 billion of those and concentrate them and put them right into where the tear is or where the damage is, your body now has the ability, because of the number and the potency of those cells, to heal the problem. Your body is already trying to heal this problem on its own. We are going to help your body do this. Your body does not have enough stem cells or platelets already in the area through normal blood flow going into the area. We need to get it reinforcement. We need to go into other areas of your body where you have billions of these cells, gather those cells, and directly inject those cells right where the problem is, so your body can then use your own cells to help improve your own condition, to help heal this problem. Your body is trying to do this already on its own, but it needs help. That's what we do. We're calling in reinforcements. Just like if there was a natural disaster, the government would call in the National Guard to help. They're already there, but they need more people. Your shoulder needs more cells. We need to gather those cells, bring them to your shoulder, place them in the precise location, so then your body can do what it's trying to do already. The cells in our body that aid in healing are the mesenchymal stem cells that are located in bone marrow and platelets, which are located in blood. We need to go after these cells, capture these, place them in the area where they're damaged, and then they orchestrate a healing response. These are the healing cells that we have. You don't have enough of them in the area where the damage is, so we need to go and get them from where they're concentrated in your body, move them to where the problem is, and have them do what they naturally do. So a great question is, what is the success of an orthobiologic treatment, especially when you're comparing it to rotator cuff surgery? And the answer to that is the success is extremely high for the conditions that we treat once we have identified you as being a good candidate to undergo this procedure. As I mentioned previously, not everybody is a good candidate, and some people do need surgery. But if you are a good candidate and we've identified you as being a good candidate and we perform this procedure, the success rate is approximately 90% of our patients have significant and often complete recovery from these problems. So at Regenexx Pittsburgh, we are part of a national database where we gather the results of all of our patients, which get put into a national group. So there is significant high numbers, and we analyze this data to show, and we publish this data to show to everybody the results of our procedures. I know I have been giving you a lot of information about your rotator cuff and treatment options. So why should you have this procedure done now as opposed to putting this off? And the main reason is because the longer you put this off, the bigger the problem will become and the longer it will take for you to get better. So stay tuned and see me in the next video where I'm going to go into more detail about the timing of this procedure and the results.